Hello, everyone. Welcome to the fifth episode of Truth Tracker, a podcast dedicated to combating misinformation in all topics of the political atmosphere and the scene of the United States of America. Thank you so much for tuning in to today's episode. I really appreciate it as we've been kicking this podcast off. Before we get into today's episode, I just want to thank everyone for tuning in. I really appreciate it. Thank you so much for subscribing and liking and watching these videos. I'm really passionate about it, and I really enjoy. I'm really excited that you guys keep on coming back. So I really appreciate everyone who's been tuning in. Before we continue, I'd just like to ask everyone, if you haven't, make sure to like this video if you're enjoying it. Subscribe to the channel, as well as turn on post notifications so that way you can be notified anytime we upload a new episode, anytime we upload one of our weekly episodes. And yeah, so today we will be tackling misinformation within the political topic of healthcare reform, because there are a ton of myths regarding that. And this episode is going to work the same way as the last couple of episodes. We're going to be tackling busting 10 myths regarding healthcare reform. And before we get into our weekly episode on civic engagement. So yeah, with that being said, thank you everyone for tuning in, and yeah, let's just get straight into today's episode, and let's go bust 10 myths on healthcare reform. So our first myth is that healthcare reform means government-run healthcare. Now, most healthcare reform proposals actually just simply aim to improve the existing private and public insurance systems rather than establish a, per se, single-payer government-run system that results in government-run healthcare. For instance, if you take a look at the Affordable Care Act, it just simply expands access to insurance through private insurers and Medicaid rather than creating a government-run healthcare system. Many of the healthcare reform laws that are proposed and passed often focus on just increasing coverage through private insurance and the markets, as well as public programs, rather than replacing all of the private insurance in the private sector of our country with government-run care. Through establishing state-based insurance exchanges, as well as expanding Medicaid eligibility. And we got our information from healthcare.gov, as well as the Congressional Research Service. So these are two very reputable websites and services, and provide very accurate and reliable information on this topic of healthcare reform. So at the end of the day, this is just simply not true. Healthcare reform does not mean government-run healthcare, as most healthcare reform proposals just simply propose improving the insurance that the private sector as well as the public sector are offering to the American people. So at the end of the day, this myth is simply not true. Our next myth is that healthcare reform will lead to long wait times and a reduced quality of care. Now, evidence from other countries that have enacted healthcare reform systems show that while wait times for some effective or some per se elective procedures can be longer, the overall quality of care is often way better because of the preventative care that's available, as well as the broad access to it. And many of the systems are also focused on patient-centered care, as well as the efficient use of resources, which actually lower the wait times for most medical procedures and events. If you look at countries like Canada and the UK, who have implemented healthcare reform laws, their wait times for non-emergency procedures have gone down. Furthermore, these systems have generally provided high-quality care and improved access to services with a focus on preventative and primary care. And so we can see that based off that sort of explanation, healthcare reform will not lead to long wait times and a reduced quality of care. In fact, there's evidence shows that it actually leads to the opposite, as wait times often go down and quality of care often goes up. And we got this information from the OECD health statistics, as well as the Commonwealth Fund. So yeah, these are two very reputable websites again that produce very correct information as well as accurate information. So at the end of the day, the second myth here is simply not true. Our next myth is that healthcare reform will increase taxes significantly for everyone. Now, in order to generate healthcare reform, it is true that oftentimes you will need to pass targeted tax increases, especially for higher income individuals and or large corporations in order to fund the initiatives. But the sort of big misconception here is that oftentimes basic middle class people are going to get their taxes increased to fund these initiatives regarding healthcare reform, which is simply not true. Most of the tax increases that are going to fund healthcare reform are to higher income individuals and large corporations rather than broad based tax hikes for the majority of the United States of America. The goal is with these kind of tax increases is to finance improvements in healthcare access as well as reduce overall costs. If you look at, for example, the Affordable Care Act, this included a simple tax increase on high income earners and in tax on high cost employer sponsored health plans. And so this helped balance costs and make healthcare more affordable for individuals. And we got this information from the Congressional Budget Office as well as the Urban Institute. So same thing again as the last 2 minutes, very reputable organizations and services who just provide accurate information. So at the end of the day, if you look at this, it's true that it'll increase taxes, but it will not be for everyone. It'll just be, and it also won't be significant. It will just be targeted tax increases for higher income individuals and large corporations in order to pay for the policies that include healthcare reform. So at the end of the day, this myth is simply not true. Our next myth is that the Affordable Care Act is a government takeover of healthcare. So the Affordable Care Act is a major piece of legislation that's often debated in the debate of healthcare and its effectiveness. And it was passed by President Obama in his first term in office and was considered to be his signature legislative achievement throughout his presidency. The simple fact with this piece of legislation is that the Affordable Care Act was designed to expand access to healthcare through the existing private insurance market as well as Medicaid. And it also introduced regulations and support for private insurers and expanded Medicaid rather than sort of taking over the whole healthcare system. You can look at today, for example, we don't have a government-run healthcare system or a government takeover of our healthcare from the Affordable Care Act. All it did was simply expand access through the existing private insurance market as well as Medicaid. Simply put, the Affordable Care Act aimed to improve healthcare insurance coverage by creating, state-based exchanges, mandating coverage requirements for insurers, and expanding Medicaid. And it did not replace private insurance; it just simply regulated it more closely. And we got this information from healthcare.gov as well as the Kaiser Family Foundation. So this sort of notion that the Affordable Care Act is a government takeover of healthcare is simply not true. It in fact just expands on it makes sure that it expands the access that people have to healthcare through expanding on private healthcare systems as well as Medicaid. So this myth has been busted. Our next myth is that healthcare reform will eliminate choice in doctors and hospitals. Now, most healthcare reform proposals generally just aim to expand provider networks and improve access to a range of healthcare providers rather than restricting a choice. There's not many healthcare reform proposals that simply eliminate your choice to a doctor or a hospital. For example, if you look at the Affordable Care Act, which is which is one of the few major healthcare bills that have been passed in the last couple of years, the last a few years. The Affordable Care Act has included provisions to increase the number of available providers and expand networks through insurance marketplaces, which has allowed people to gain a larger choice in their doctors and hospitals. And while specific plans may have different sort of networks and services, the goal with most healthcare reform proposals is to provide a broader access to a variety of providers. And we got this information from the Kaiser Family Foundation, which we cited in the past, as well as as well as Health Affairs. So these are two very reputable services, and so at the end of the day, if you look at the evidence, this myth is simply not true, and is in fact, the opposite is true, as healthcare reform will actually increase choice in doctors and hospitals. Our next myth is that healthcare reform will only benefit low-income people. Now, healthcare reform efforts are designed to benefit people across different income levels, from people that are of a lower socioeconomic status all the way to people that are of a high socioeconomic status, through providing subsidies, improving coverage options, as well as reducing overall costs. Because the Affordable Care Act includes subsidies for middle-income individuals to make insurance more affordable, and it has also expanded Medicaid for lower-income individuals. The reform efforts, or most healthcare reform proposals, aim to improve access and affordability for a broad range of people. And so, at the end of the day, there's the notion that healthcare reform was only targeted to people of a low socioeconomic status is simply not true, and in fact benefits a wide range of people across all different incomes. And yeah, so at the end of the day, this myth is simply not true and has been busted. Our next piece of evidence is that healthcare reform will force people to get insurance that they do not need. Now, healthcare reforms typically offer a range of coverage options that suit different people as well as their different health needs and how they want to look after their bodies, which allow individuals to choose plans that fit their health as well as financial situation. For example, most healthcare reform proposals a mandate that insurers offer essential health benefits, but also allow flexibility in healthcare plan design in order to meet the diverse needs of all the different people, to meet their health and financial situations. For example, individuals could choose from different plans based on their specific health needs as well as their monetary budget that they have. So, at the end of the day, this is not true. There's not really any notion of healthcare reform forcing people to sort of get insurance that they don't need. It just provides people with the choice to get whatever they need. And so at the end of the day, this is not true, and we got this information from healthcare.gov as well as the Kaiser Family Foundation. So this myth has been busted. Our next myth is that healthcare reform will result in more bureaucratic red tape. Now, many healthcare reforms, actually one of the big goals of them is to reduce the administrative burdens and that have crippled the healthcare system in the United States of America, as well as streamline processes to improve efficiency as well as patient experience, which is designed to which is accomplished through removing bureaucratic red tape. For example, the Affordable Care Act has included measures to simplify the enrollment process as well as reduce administrative costs. So at the end of the day, the goal of the Affordable Care Act, as well as most healthcare reform proposals, is to make it easier for people to access and manage their health insurance. And we got this information from the Kaiser Family Foundation, as well as Health Affairs. So at the end of the day, most healthcare reform proposals are designed to decrease bureaucratic red tape. So this myth has been busted. Our next myth is that healthcare reform will decrease funding for medical research and innovation. Now, a very unknown fact about most healthcare reform proposals is that they include initiatives and policies that create provisions to support and fund medical research and innovation to advance the health outcomes for the people of the United States of America, as well as reduce long-term costs. For example, if you look at the Affordable Care Act, it provides funding for research through the Patient-Centered Outcomes Research Institute and other programs to support medical research, innovation, as well as improve treatment options. And we got this information from the Patient-Centered Outcomes Research Institute, as well as the National Institute of Health, otherwise known as the NIH. And so this evidence and this explanation shows that this myth is simply not true, and in fact the opposite is true, as healthcare reform is designed to increase funding for medical research and innovation rather than decrease it. So at the end of the day, this myth has been busted. And our final myth for today is that all healthcare reform efforts are unsuccessful or lead to negative outcomes. Now, many countries, especially countries in Europe who have adopted these sort of healthcare reform proposals, have seen positive results such as improved access to care, better health outcomes, and reduced costs. For example, healthcare reforms in countries such as the UK and Sweden and Canada have generally led to improved health outcomes as well as more efficient healthcare. And at the end of the day, these sort of healthcare reforms do have challenges, as all policies do, but they overall often result in overall system improvements. And we got this information from the World Health Organization as well as the Commonwealth Fund. So at the end of the day, this kind of ties into this whole idea of combating misinformation, which is where you should get your information from, key and accurate sources, as well as double check and cross check your information just to make sure that you're opening yourself up to more perspectives as well as achieving accurate information. So, as you can see, the two resources that we use for to achieve or bust this myth are very accurate and are correct. And so, at the end of the day, this myth is simply not true. Most healthcare reform proposals are in fact successful and lead to positive outcomes. And that should be it for our busting misinformation section. And now we're going to get into our weekly civic engagement section where we encourage everyone to vote. Now, as obviously the election gets closer, and these sort of political topics such as healthcare reform are beginning to get discussed, it's super important that you use your responsibility or your duty or your right to vote. As for example, to advocate for policies that you believe in within the healthcare reform debate that's currently happening in America. It doesn't matter what you believe in with this on this support sort of debate. The big thing is that you're using your right the right to vote as your way of showing the elected officials what you believe in and the policies that you want to be enacted. So at the end of the day, this is a super important part of our democracy and is really the only way that our democracy per se stays alive is through voting. And so therefore, just using today's episode as an example, if you feel passionate about this or about this topic of healthcare reform, it's super important that you go out there and vote, as well as if you feel passionate about any topic and want to create political change, it's super important that you go out there and vote on election day this year in 2024 as our civic duty to make sure that we all vote and hold our elected officials accountable and make sure that we are creating a America that we all want to live in, and that's achieved through voting and making sure that we're doing our job as civilians or as citizens to make sure that we put elected officials in office that we want to advocate for all policies, no matter who we've uh, necessarily support. And so at the end of the day, it doesn't matter who you support at all. Just make sure you get out there and vote. It's super important. It's one of your greatest, I would say, civic responsibilities. And so yeah, at the end of the day, thank you so. And at the end of the day, it's super important to get out there and vote. I would go begin checking to make sure that you are registered to vote. And if you're not, making sure you do get registered to vote in your specific state. And yeah, thank you so much. Yeah, that's pretty much it actually for the civic engagement aspect. Thank you so much, everyone, for tuning in today's episode. The biggest, I guess, takeaway you can take away, or the biggest takeaway, I guess, would be from this sort of civic engagement aspect is to just get out there and vote and use your voice. And so, yeah, thank you so much for tuning in today's episode, everyone. I really appreciate it. If you haven't already, make sure to like this episode, subscribe, and turn on post notifications. And yeah, thank you so much for all your support, and have a great day. Goodbye.